Robert F. Kennedy Jr., the Health and Human Services Secretary, had a busy first week of the year. On Wednesday, he issued a new dietary guideline for Americans and unveiled this new graphic showing an inverted version of the food pyramid. You see meat there at the top.
The dietary guidelines rest on three pillars: protein, healthy fats, vegetables and fruits, and whole grains. These guidelines replace the corporate-driven assumptions with common sense, gold standard scientific integrity. These new guidelines will revolutionize our nation's food culture and make America healthy again.
Earlier in the week, the Centers for Disease Control and Prevention reduced the number of vaccines recommended for children from 17 to 11. Vaccines against diseases including hepatitis A and B, meningitis, dengue, the seasonal flu, and the rotavirus were left off of the new immunization schedule. Joining me now to break all of this down is Spectrum News health reporter Erin Billups. Good to see you. Thanks for coming in. Let's start with the vaccine recommendations. This is a major shift in federal vaccine policy, right? I mean, it's individual states that mandate vaccinations for children. It's not the federal government, so states actually don't have to comply with the updated recommendations from the CDC. But there's still a source of controversy here. I mean,
yes, it's very controversial, but you're right. The stability of the nation's infrastructure, immunization infrastructure, rests on the states, and we're already seeing action according to that. States have kind of combined into coalitions. You have the, like the Eastern Coalition and the Western Alliance, and they're making their own vaccine policy, which then does help to dictate what insurance companies cover, and they're reaffirming traditional immunization schedules. But what the CDC recommends is incredibly influential, and it sort of gives license to, politicians and those in other states who don't want to follow that guidance. And we are already seeing that happen in Florida. They have rolled back school mandated immunization requirements. And there are several other states, Texas, Louisiana, and Idaho, who are also making moves to do the same thing.
Now, Secretary Kennedy is a known vaccine skeptic, and mistrust of vaccines has actually led to declines of vaccination rates all around the country. In New York, they are experiencing a surge in flu cases with vaccination rates dropping. But the United States actually has recorded a significant number of measles cases, and that's a preventable disease. How much of that is Kennedy's fault?
He has been part of that dialogue and that rhetoric for years now. So what we're seeing now is actually built up over the past couple of decades of talk against the validity of vaccines. And then we're going to start to see these cases continue to rise. We're already starting to see greater outbreaks, and we're about to lose the status of having eradicated measles. And right now, we're in a flu outbreak that it is a very dangerous, aggressive strain. They're calling it subclade K. It's making people very sick. It's causing pediatric deaths. And at the same time that they changed the immunization schedule for children, which also includes not necessarily recommending the flu vaccine, on another page on the CDC's website, it's recommending, because of the current outbreak, that everyone 6 months and older get vaccinated against the flu because we're in the middle of an outbreak. So there's a lot of conflicting information there.
Let's go back to the dietary guidelines. Speaking of conflicting information, these are tough recommendations that seem to be completely opposite to what you and other health reporters have been telling us over the years. What should the takeaway be for our viewers? What are you hearing from nutrition experts about all this?
Well, there's mixed reviews. Generally, people are concerned with what you can see on that pyramid of, the red meat front and center. This idea that people should be eating only protein. There's good stuff behind having a protein-filled diet, but there's also concerns. Say the American Heart Association was like, this may lead people to exceed the amount of, fats and salts that they should be taking in. Nutrition experts say there needed to be more nuance there. But in general, you're hearing from the American Medical Association, the Academy of Pediatrics, that this is a good conversation because they want people to get rid of ultra-processed foods in their diets. They want them to get rid of sugars. They want them to focus on whole foods, whole vegetables. That's what's going to make America healthier.
Now, my understanding is that, according to research, most Americans actually don't even read the dietary guidelines, but it does influence school meals and a lot of other kind of institutional decisions along the way.
It does. And So this guidelines committee gave the guidelines to the USDA as well, and then it helps to inform food nutrition policy for schools. And if school meals are not, adhering to that policy, they may not get those meals reimbursed for their students, depending on how hard it's enforced on the state. So this definitely impacts what we'll see in schools. But again, on the flip side, if they really do come down on ultra-processed foods, that may mean that there will be less ultra-processed foods in our nation's schools, which could be a really good thing for our kids, because there are lots of fillers and food dyes and additives in their foods, and these ready to make, just heat up the meals that kids are being given, that really should change.
Okay, we will keep an eye on all of that. Thank you very much, Erin Billups. Thank you for watching our YouTube channel. Let Spectrum News be your resource for balanced, in-depth political coverage, and click the subscribe button right here. You can also download our app or watch us on TV to learn more about the candidates, where they stand on the issues, and more. We'll see you then.